I was suffering from back pain and inflamed tendons. My general practitioner could not find the source of my pain, so he diagnosed somatoform disorder, a mental disorder. A second doctor found a chronic inflammatory disease, which allowed for the correct treatment. I learned only because your doctor doesn't find the source of your symptoms, it doesn't mean you have a mental problem. Maybe he just doesn't know. A second opinion can be very valuable. My chronic pain was misdiagnosed as somatoform disorder. In the first chapter I will describe my pain. In the second chapter I will describe my interaction with my first doctor, which was clueless and suspected a mental problem, somatoform disorder. In the third chapter I will talk about my second doctor, which found the correct chronic inflammatory disease, in my case ankylosing spondylitis. And in the first chapter I will give you my conclusion, get a second opinion. In this chapter I will show you the problem, my chronic pain. The first time I visited my general practitioner because of my back pain was in the year 2005, at the age of 18. My general practitioner prescribed exercise. However, as I described in my exercise review video, exercise didn't help me enough. Over the course of several years, my condition became worse. My back was painful. Several tendons were inflamed. The situation was different every day. Many days were painful, but some days were more painful than other days. For years, my back was painful every night and less painful during daytime. However, my different tendons were inflamed for only a couple of weeks each time, before becoming better again, only to become painful again a couple of weeks later. My health insurance claims report shows the doctors I visited, the laboratory test and the diagnosis. This claims report supports my memory about the timeline from symptoms to diagnosis, as well as how I managed to turn off my symptoms later on, to paint a reliable picture for you. My health insurance claims report shows the doctors I visited, the laboratory test performed and the diagnosis. The claims report shows that my Achilles tendons were severely inflamed once or twice a year. As a result, I couldn't walk. I describe this in more detail in a video describing what helped me to get over Achilles tendinitis. Sometimes my Achilles tendons were inflamed. Other times, different tendons were inflamed. Every morning surprised me with something new, which didn't hurt the day before. My first general practitioner couldn't find the source of my symptoms. I visited my general practitioner several times. He didn't find the source of my pain, so he made a different diagnosis each time I visited him. My general practitioner diagnosed back pain, nerve irritation, inflamed tendons, nerve pain, but after a couple of visits he remained clueless what ultimately caused my symptoms. So he diagnosed somatoform disorder, which is a mental disorder that manifests as physical symptoms that suggest illness or injury, but cannot be explained by a general medical condition. Somatic symptom disorders are included in a number of diagnosis schemes for mental illness. Imagine, you go to your doctor, tell him my Achilles tendons are inflamed and my back hurts. And he will say, you're probably just crazy. He didn't say, I'm sorry, I could not find the source of your suffering. I don't know everything. Maybe try another doctor. He might know more. He will say instead, do you know why you feel painful? Because you're crazy, that's why. My doctor didn't use those hard words, but basically he said the same in a more polite way that my pain is a result of mental problems. Imagine you are in school as a student in a math test and you can't solve the math problem. Is the teacher crazy? Or maybe you just don't know. Imagine you buy shoes. The shoes are too small, they hurt your feet, and the salesperson yells at you. The shoes are perfect. Buy the shoes, you lunatic. In a shop, the paying customer is the boss. At the doctor, the paying customer is not the boss. The doctor is. If he can't help you, you're the crazy one. Chapter 3. My second doctor finds a chronic inflammatory disease. I suffered from back pain and inflamed tendons for years, but my first general practitioner could not find the source, so my suffering continued. One time, in the year 2013, I was lucky. My general practitioner was on vacation, so I visited his replacement, a second general practitioner. He had an excellent idea. He thought, if a patient has chronic pain for many years, maybe he has a chronic inflammatory condition. So he tested me for HLA-B27, and the test was positive. A positive HLA-B27 test can be a hint for ankylosing spondylitis. My general practitioner made a blood test to check 2 blood inflammation markers. High blood inflammation markers strengthen the suspicion that I suffer from a chronic inflammatory condition. My general practitioner sends me to a rheumatologist. 11 years after the onset of my symptoms, my rheumatologist confirmed the diagnosis: ankylosing spondylitis, an autoimmune disease leading to the long-term inflammation of the joints of the spine. After 11 years of searching, I finally got a name for my disease symptoms: ankylosing spondylitis. To get a name was a step forward. Now with the diagnosis, I hoped to become better soon. Chapter 4. Conclusion. There's a reason why you feel bad. And the reason is probably not being crazy. Only because your doctor could not diagnose your disease doesn't mean your body works optimal. Switching doctors helped me. Educating myself also helped me. Become an active manager of your own health today for a better feeling tomorrow. What symptoms did you have? Was it difficult for you to get the correct diagnosis?